Hey, good morning. It's a gorgeous day up here in Brevard, North Carolina. You'll see our view from our Airbnb. Like, wow. This morning, the sunrise was spectacular lying in bed. But I want to talk to you a bit today about why it's difficult, if not impossible, for your doctor to give you the best treatment for corona. Why they can't or won't. All right. And this is really based on about 26 years of my personal experience dealing with this sort of thing. And, my background is more like education wise, is more like economics and business, but also like 26 years in kind of holistic health as well. And I'm not a medical doctor, but a lot of the people I learned all this from are medical doctors, including one who was at one time voted the number one doctor in the Dallas Fort Worth area. So, the first thing to understand um, is it's not a weird conspiracy, so to speak, for the most part. It's more business, you know, economic drivers. Paul Zane Pilzer, a very famous economist who um, was an economist for multiple presidents and has an incredible ability to predict different economic shifts. Um, he said, "Look," he goes, "it's not evil men in the back room plotting against people. It's it's business incentive. It's economic drivers, and economic drivers can be 10 times as deadly as evil plots." Okay. He commented about this. He said, he goes, for a potato chip manufacturer, it is cheaper to and easier to sell 2 bags of potato chips to the same customer than to go out and get a new customer. So what do? They make the first bag of potato chips peculiarly addictive, right? To put ingredients in it that override your natural feeling of fullness and keep eating. He commented on this that he was talking to one of his friends about some new food product and asked him, "Oh, what do the focus groups say?" And his friend said, he goes, I can't even look at the focus groups. He goes, literally, my job is to take a 200-pound woman and turn her into a 240-pound woman. So I want to give you a couple actual real world examples of how this works, and then maybe some specific stuff related to COVID so you understand it. And what I want you to do is, I don't want to depress you by this, but I want to encourage you to take real personal responsibility for your health, as scary as that sounds. Okay. So the thing to understand in the US is you really have two different groupings. You have food and drugs. Okay. And you cannot make health claims on food, even if it's clearly obvious. And it is to like a slightly ridiculous degree. You could not put on an orange label saying this will cure scurvy, right? you can't do that. Well, will it? Well, duh. But you can't put that on the label because that's a medical claim, you understand. And, in the US in particular, in 1994, something called the DSHEA Law, the Dietary Supplements Health Education Act, was passed. And it was supposed to create a new category where if you had a supplement that was standardized and you knew the ingredient, the active ingredient in it, and you had a decent amount of research, you can make limited legal label health claims. And um, after the law was passed, though, you have to implement the law, and the law was given to the FDA to implement, and it's never gone anywhere. So, still, basically, in the U.S., you have food and drugs. Okay. Um, Years ago, I was marketing a supplement that worked especially well on things like colitis and Crohn's and irritable bowel syndrome and everything. And I had met a woman, and I had helped her with a particular autoimmune disorder using this supplement. And then I also helped her husband. He had, I believe, irritable bowel syndrome. He got tremendous results. He was a doctor for Kaiser at the time. And we're driving in the car one day to a meeting about this supplement. And I said, "Hey," I go, "are you going to tell your patients about this?" He goes, "No, no." He goes, I can't do that. I go, "Why?" He was an internal medicine doctor, probably seen quite a few people that it could help. He goes, "I can't do it, Steve." He goes, "It's not accepted standard of care." Okay. And he goes, if I do something outside of accepted standard of care, I could find myself in court with the lawyer asking me, hey, doc, when treating my client, did you or did you not practice accepted standard of care? And I'd have to say, no. And the lawyer would be like, okay, no further questions. You're guilty, right? So it has nothing to do with what he felt would be helpful or safe or effective, more to do with what was decided was the right course of action, okay? More ridiculousness from my personal friends. One of my friends, Dr. Reg McDaniel, who's voted Physician of the Year in Dallas-Fort Worth area, I believe, when was that? Early 90s, I think it was. Anyways, long story short, he got involved in doing some research on the functional component of aloe vera at the time when AIDS was raging. It was everywhere. And they were getting some pretty good results, and they ended up doing a predictive study. Okay, a predictive study. They said if your T cell counts are here and your viral load is here, we predict it will work for you. Well, they got an 84% success rate with this, okay? And he goes, my only thought was, what tie should I wear when I'm on the cover of Time magazine? Because clearly we've solved this issue, right? And in the early 90s, the general accepted scientific premise was that carbohydrates were only good for fuel. They had nothing to do with any structural functional role in the body. And so they took the results of this pilot study, they took it to an international AIDS symposium in Switzerland. And people were like, wow, well, that's some impressive results. What was it that got this result? And he has to say, he goes, it was a carbohydrate. And everyone looked at him like, ooh, he was an idiot. And they're like, you stupid Hicks from Texas. He goes, everyone knows that's not true. And since you don't even know it's actually working, then the whole study is worthless. Okay. So that's just one example. And the other thing to understand is it's not so much what works, or even if a pharmaceutical company has something that's effective, you have to understand getting something through the regulatory process to be accepted standard of care or to be approved as a drug for anything is a brutal process. If you want to dive more into this, there's a book called Good Intentions by a guy named Bruce Nussbaum. And I believe he was an editor for Business Week or something like this. And at the time, he looked at the epic amount of money going into research on finding a cure/treatment for AIDS at the time. And only AZT had come out, and AZT was not effective and super toxic at the time. And he goes, well, this is insane. He goes, how can you spend so much money on a treatment and research and get such little out the back end? And he did a bunch of research and interviews. I think Burris Wellcome was the pharmaceutical company that took AZT. And basically, it was absolutely fascinating book. Basically, the bottom line was Burris Wellcome had the right business approach, even if they didn't have the right solution. And all they did with AZT is they took the virus and they tested everything that had gone through the FDA approval process a little bit. And they tested everything against that virus. And AZT worked a little bit, so they ran with it. They didn't ever bother really trying to come up with a better solution. And there you go. That's why they had AZT. Yet at the same time, there was a Israeli pharmaceutical company that had developed something from eggshells, which was like really, really effective on the virus, but they just weren't very good at getting everything through the regulatory process. And how ridiculous is the regulatory process? Well, here's another example. My friend Dr. McDaniel, in attempting to get this one molecule from aloe vera approved as a drug, the first thing you really run into is you do something called an LD50 study, which means lethal dose 50th percentile, which means you have to show how much of your drug it takes to kill 50% of the test animal. So they did the study and they submitted the paperwork, and the FDA said, well, you're not really filling the paperwork out properly. They're like, what do you mean? They're like, well, you didn't kill anything. And they're like, because it's non-toxic. And they're like, sorry, you're not filling the paperwork out properly. He goes, literally, we ended up giving one of the rats so much of this that it burst its stomach and it died from that. And then we filled the paperwork out properly. Is it that ridiculous? Oh, yes. Is that ridiculous? So one of the things to understand is what gets approved as a drug is not what the most effective drug is. It's who was successful in getting it through. Okay, that's one of the big issues. Another slightly goofy story about pharmaceutical companies and cutthroat business practices. I mean, you have to understand that anything that's a non-drug approach that might work on a health issue or disease is, man, you're met with major dirty business practices, okay? You know, understand that pharmaceutical companies have been willing to spend billions, happily willing to pay billions of dollars in fines for unethical business practices. I mean, just look at Vioxx. Vioxx killed like 50,000 people before that pharmaceutical company finally pulled it off the market when they already knew that there were issues with it. So one of my friends was working with a hospital in England. I believe it was the Royal Bournemouth Hospital, and he had worked directly with a surgeon who was also Prince William and Prince Harry's personal physician. And she was quite fascinated with the effectiveness of a certain supplement. And they had decided they wanted to see what the supplement could do in general without reference to a particular health condition. And so they had decided to do a study and where they would put every single person walking through the hospital doors on this particular supplement regime. And they'd filled out the purchase orders and everything from the company that made it. And one day then the hospital administrator approached this particular doctor and said, we're not going to do the study. She goes, well, what do you mean? I mean, we're ready to do it. We've signed the purchase order, everything. He goes, nope, not going to do it. And he wouldn't tell her why until she pushed him. Finally, he admitted this. He goes, look, I get a £7 million a year grant from a certain pharmaceutical company. And they have informed me under no uncertain terms that if I go through with this study on this supplement in this hospital, they will yank my grant. He goes, I cannot run the hospital without that grant, and we cannot do this study. So that's just one of many examples. But if we then focus more on COVID, okay, really, if we're talking about treatment for really, are we really reliant on a nasty vaccine that has potential major side effects? Is this the only option out there? You know, interesting enough, how many different things practitioners, doctors who are working with patients are saying, hey, well, this is what I'm doing, and it's working. It's working like phenomenally well. Very little toxicity, amazing results. And it's like crickets. No one's adopting it. No official FDA approach is adopting it. And it seems quite insane. I have one physician, a friend of mine, who uses a very, you want to say, here's the dog. Hey, buddy. Say hi. Mr. Fitty. One of my physician friends uses a much more holistic approach. And a few months ago when hydroxychloroquine was all very controversial, right? And I asked him, I go, well, so your patients with COVID, do you use hydroxychloroquine? And he goes, oh no. He goes, simply aggressive amounts of vitamin C, vitamin D, and zinc. He goes, I've never had to, and none of my patients have ever had to go to the hospital or ICU for COVID. Wow. Okay. And here we have all these lockdowns because we can't let it spread because we can't let overwhelm the hospital system. Okay. This is ridiculous. There was one study done in Spain, and what they did, they took people who were already sick with COVID, and they had a control group that they did nothing with, and a test group where they use very aggressive amounts of vitamin D. Okay. No deaths in the group doing vitamin D, and only one ICU admission at all. Now you would think, hey, look, you would think everyone would adopt that and adopt it quickly because what? Vitamin D is cheap and non-toxic, right? But no, not happening. I think even more ridiculous lately is ivermectin. Ivermectin is a drug that's been used for a very long time. It's famous for being incredibly effective for a wide range of things. Some people also getting some freaky, absolutely freaky results treating cancer with ivermectin. Anyways, its safety profile is well known, been around for a very long time. And here's the big problem, it's cheap now, very cheap. I posted a while back one doctor who's treats COVID patients all over. He goes, that's almost all he does. And he represents a group of doctors who are all highly qualified. And he goes, what we've been doing is we've been looking for use other drug uses on COVID. Okay, what else has already been approved that will actually work on it? And he goes, I don't use the term miracle lightly. He goes, literally, ivermectin obliterates transmission for COVID. And he gave multiple studies. One study done in Argentina where they took 800 people and gave them ivermectin. I believe these are all healthcare workers. They had absolute zero transmission rate of COVID. Zero, like nothing, zip. On the control group where they did nothing, I think it was maybe 480 people or 500 people, they had a 48% transmission rate. That's like for a drug that's well proven and super safe. Like you would think, oh, well, solved, right? this is totally solved. No, not happening. Why? Business, okay? Ivermectin is literally 1/30th the cost of this new vaccines they're coming out with, okay? By the way, the vaccines, the bar for effectiveness is incredibly low. It's like if they can prove that it will reduce some of the symptoms, then they're like, okay, it's effective. Now, they're not even talking about using the vaccine to make sure you don't get COVID. That's not even part of it. They just want to improve your body's ability to respond to COVID. Yet ivermectin obliterates transmission. But they're not interested in that, right? Anyways, I could go on and on and on. But what does it ultimately mean? It means that your friends who are doctors and nurses, my brother-in-law is a doctor. My niece is a nurse. She deals with COVID all the time. It's not that these people aren't knowledgeable or compassionate or anything like that. What you have to understand is the structure within that they have to work in is fundamentally flawed. I mean, especially in the U.S. I think the World Health Organization once rated the U.S. as 37th in terms of the effectiveness of our healthcare system in delivering results. Yet, far and away, the most expensive in the world. Now, if I had a sports team and my sports team spent more money on players than any other sports team in the whole league, and yet we were consistently ranked 37th, okay, how long do you think the coach lasts? Half a season, right? The owner would change everything, fundamentally everything, unless it was very profitable to run it that way. And therein lies the problem. Anyways, hope you all have a wonderful Christmas and that this is helpful insight for you.